Medications used in cardiac patients. Anticoagulants are given when there is evidence or a likelihood of a clot formation. It is contraindicated with active bleeding, such as DIC, bleeding disorders or blood dyscrasias, ulcers, liver and kidney disease, and hemorrhagic brain injuries. Heparin prevents the conversion of fibrinogen to fibrin and decreases coronary artery thrombosis. The blood levels to maintain a therapeutic level of anticoagulation when the patient is receiving a continuous infusion of heparin, then the APTT should be 1.5 to 2.5 times the normal value. If the APTT is too long, longer than 80 seconds, dosage should be lowered. If the APTT is too short, less than 60 seconds, the dose should be increased. Continuous infusions must run on an infusion pump to ensure a precise rate of delivery. The antidote is protamine sulfate. Enoxaparin, Lovenox. This is administered by subcutaneous injection only to the recombinant patient in an anterolateral or posterolateral abdominal wall. Do not expel the air bubble from pre-filled syringe or aspirate during injection. The antidote is protamine sulfate. Warfarin sodium, Coumadin, prolongs the PT. The therapeutic range is 1.5 to 2 times the control value. If the INR is below recommended range, the warfarin sodium should be increased. If the INR is above recommended range, then the warfarin sodium should be reduced. The antidote is vitamin K. Dabigatran, Pradaxa, or rivaroxaban, Xarelto, both need to observe for bleeding gums, bruises, nosebleeds, hematuria, hematemesis, occult blood in stool, and petechiae. Neither one have an antidote. Apixaban, Eliquis, prevents the platelets from sticking together and forming a clot. It is used after a knee or hip replacement to prevent DVTs. It is contraindicated for spinal tap or epidural anesthesia, and a patient should stop taking nonsteroidals. Patient teaching should be to observe for the bleeding gums, bruises, nosebleeds, hematuria, hematemesis, occult blood in stool, and petechiae, and there is no antidote for Eliquis. Fondaparex, Arixtra. The air bubble is not ejected before giving the Arixtra in order to avoid the loss of the medication. Thrombolytic medications, they dissolve the clots. They should be started within 6 hours of the onset of a myocardial infarction, so the time at which the chest pain started is the major determinant of the appropriateness of this treatment. It is contraindicated in active bleeding, stroke or other intracranial problems, surgical patients, hepatic or renal disease, uncontrolled hypertension, recent cardiopulmonary resuscitation, or hypersensitivity. The side effects are bleeding, dysrhythmias, and allergic reaction. Monitor for neurological changes such as slurred speech, lethargy, confusion, and hemiparesis. Withhold the medication if bleeding develops and notify the healthcare provider. Aminocaproic acid, or Amicar, is an antidote for TPA that may be used only in acute life-threatening situations. Anti-platelet medications inhibit aggregation of platelets and prolong bleeding time. The side effects are GI bleeding, bruising, hematuria, and tarry stools. Instruct the patient to monitor for side effects related to bleeding and in measures to prevent bleeding. Because the anti-platelet effect of Clopidogrel is reduced when it is used with omeprazole, the nurse should clarify this prescription with the healthcare provider. Plavix is used for treatment of patients at risk for ischemic events, history of MI, ischemic stroke, peripheral artery disease. It is also for treatment of patients with acute coronary syndrome. It is contraindicated if they have an allergy to Plavix, an active pathological bleeding such as a peptic ulcer or intracranial hemorrhage, or are lactating. Use cautiously with bleeding disorders, recent surgery, hepatic impairment, or pregnancy. A side effect is a blood clotting problem called thrombotic thrombocytopenic purpura. Cardiac glycosides, like digoxin, increases the force of myocardial contraction and slows the heart rate. The side effect is GI disturbance, anorexia, nausea, vomiting, and diarrhea. Nausea is an indication of dig toxicity and should be reported so that the provider can assess the patient for toxicity and adjust the digoxin dose if necessary. Other side effects: visual disturbances, bradycardia, and the patient will need to include potassium-containing foods in the diet to avoid hypokalemia. Patients should be taught to check their pulse daily before taking digoxin, and if the pulse is less than 60, they need to call their healthcare provider. Interventions to monitor for toxicity. Monitor the potassium level for hypokalemia and monitor the apical pulse, that it should be greater than 60. Thiazide diuretic side effects include hypercalcemia, hyperglycemia, hyperuricemia, hypokalemia, hyponatremia, and hypovolemia. Interventions include monitoring vital signs, appropriate lab values, eyes and nose, and intake of potassium-containing foods. Loop diuretic side effects include hypokalemia, hyponatremia, hypocalcemia, hypomagnesium, and orthostatic hypotension. Interventions include monitoring the vital signs, appropriate lab values, eyes and nose, and intake of potassium-containing foods. Potassium-retaining diuretics, the side effect is hyperkalemia. An intervention would include monitoring the potassium blood level. Bumetanide Bumex is a potent diuretic that causes a profound increase in urine output by preventing the kidney from retaining fluid. Specifically, it blocks the reabsorption of sodium and fluid from the kidney's tubules. It is used when edema is associated with congestive heart failure, cirrhosis, or renal disease, intravenously in acute pulmonary edema, and an unlabeled use is treatment of adult nocturia, but it's not effective in men with benign prostatic hyperplasia. It is contraindicated with allergy to Bumex, electrolyte depletion, anuria, severe renal failure, hepatic coma, or lactation. Use cautiously with lupus, gout, diabetes mellitus, and pregnancy. Side effects of adrenergic antagonist alpha blockers. They cause vasodilation and decrease the blood pressure used to treat hypertension and maintain renal blood flow. The side effects are hypotension, tachycardia, sodium and water retention, and GI disturbances. Nursing intervention is to monitor the blood pressure and apical heart rate and monitor for fluid retention and edema. Side effects of adrenergic antagonist beta blockers. They decrease the workload of the heart and decrease myocardial oxygen demands. They decrease the heart rate and blood pressure and can mask symptoms of hypoglycemia in diabetic patients. Side effects are bradycardia, hypotension, and bronchospasms. Interventions is to monitor the apical pulse rate and blood pressure, monitor for respiratory distress, instruct a diabetic patient to monitor for signs of hypoglycemia, and labetalol decreases sympathetic nervous system activity by blocking both alpha and beta adrenergic receptors, leading to vasodilation and a decrease in heart rate, which can cause severe orthostatic hypotension. Patient may also experience heart palpitations, dry mouth, dehydration, and headaches. Although carvedilol is appropriate for treatment of chronic heart failure, it is not used for patients with acute decompensating heart failure because of the risk of worsening the heart failure. One way to remember is that alpha receptors causes constriction. Beta receptors cause dilation. ACE inhibitors are used to prevent peripheral vasoconstriction and used to treat hypertension and heart failure. Side effects are persistent dry cough, hypotension, tachycardia, hyperkalemia, hypoglycemia in diabetic patients. Nursing intervention, avoid use with potassium supplements and potassium-sparing diuretics. Monitor the vital signs and for signs of hyperkalemia. Instruct diabetic patients about the risk for hypoglycemia and instruct the patient to report a persistent dry cough. Angiotensin II receptor blockers, ARBs, are an extremely potent vasoconstrictor. It also increases the release of noradrenaline, reinforcing vasoconstriction and increases the heart rate and force of contraction. It increases reabsorption of sodium ions by the kidneys and stimulates secretion of aldosterone from the adrenal cortex. Aldosterone further increases sodium reabsorption and water retention by the kidneys. Angiotensin II inhibitors bind to angiotensin II receptors and decreases the effect of angiotensin II. Therefore, vasoconstriction is reduced and blood pressure is reduced. Calcium channel blockers decrease the workload of the heart and decrease myocardial oxygen demands. They promote vasodilation of coronary and peripheral vessels and used to treat angina, dysrhythmias, and hypertension. Used with caution in heart failure, bradycardia, or atrioventricular block. Side effects are bradycardia, hypotension, and reflex tachycardia. The interventions are to monitor the apical heart rate and blood pressure, monitor for signs of heart failure, and instruct the patient to report dizziness or fainting. Nitrates are vasodilators that allow blood to flow more easily. Blood returning from the body in the veins must be pumped by the heart through the lungs and into the body's arteries against the high pressure in the arteries. Side effects of nitrates are headaches, dizziness, lightheadedness, nausea, and flushing. Sildenafil or Viagra and tadalafil Cialis and vardenafil Levitra all increase the blood pressure lowering effects of nitrates and may cause excessive blood pressure reduction. Nitroglycerin decreases the peripheral resistance, increases blood flow to extremities, and used to treat peripheral vascular disorders and cerebral vascular insufficiency. Side effects are hypotension, tachycardia, and flushing. Interventions to monitor the apical heart rate and blood pressure, monitor for signs of inadequate blood flow to the extremities, and instruct the patient to change positions slowly. Direct-acting vasodilators relax the smooth muscles of the blood vessels, resulting in vasodilation. They promote an increase in blood flow to the brain and kidneys and used to treat hypertension. The side effects are hypotension, reflex tachycardia, and edema. Nursing interventions to monitor the apical heart rate and blood pressure, monitor for fluid retention and edema. When sodium nitroprusside is given, need to monitor cyanide and thiocyanide for signs of toxicity. Sodium nitroprusside is a potent vasodilator, and a major adverse effect is severe hypotension. Nesiritide or Natrocor is used to treat decompensated heart failure. The side effects are hypotension and dysrhythmias. Nursing intervention is to monitor the apical heart rate and blood pressure, urine output, and body weight, and monitor for signs of resolving heart failure. Since it is a potent arterial and venous dilator, the major adverse effect is hypotension. A patient is likely to have orthostatic hypotension, so it's very careful about having the patient to ambulate while on Natrocor. Nesiritide does not require titration and is used for acute decompensating heart failure, but not in a home setting. Antiarrhythmics suppress dysrhythmias by inhibiting abnormal pathways of electrical conduction through the heart. The interventions for antidysrhythmics is to monitor the heart rate, respiratory rate, and blood pressure, provide continuous cardiac monitoring, administered intravenous antidysrhythmics via an infusion pump, monitor for signs of fluid retention, look for an effective response, and if an antiarrhythmic adenosine is given, it must be given over 1 to 2 seconds to be effective. Adenosine can be given for a patient with a dysrhythmia, a supraventricular tachycardia. Amiodarone has some interactions. Grapefruit and grapefruit juice may interact with amiodarone and lead to unwanted side effects. Avoid exposure to sunlight or tanning beds. It can make a person sunburn more easily. They will need to wear protective clothing and use sunscreen SPF 30 or higher when they are outdoors. Common amiodarone side effects include dizziness, vision problems, seeing halos around the lights, loss of coordination, feeling weak or tired, nausea, vomiting, constipation, numbness or tingling, tremors, or abnormal liver function tests. It could take up to several months for amiodarone medication to completely clear from the person's body. Adrenergic agonists. Dobutamine increases myocardial force and cardiac output. Dopamine increases blood pressure, cardiac output, and renal blood flow. Epinephrine, used for cardiac stimulation and cardiac arrests. Isoproterenol, used for cardiac stimulation and bronchodilation. Norepinephrine, stimulates the heart in cardiac arrest and vasoconstricts and increases the blood pressure and hypotension and shock. Side effects of adrenergic agonists include dysrhythmias, angina, restlessness, urgency, or urinary incontinence. Nursing interventions are monitor the vital signs, monitor urinary output, and monitor the electrocardiogram. Anti-lipidemic medications reduce cholesterol, triglycerides, or low-density lipoprotein levels. Nursing intervention is to increase fluid intake and fiber in the diet. Side effects are GI disturbances, visual disturbances, elevated serum liver enzyme levels. The patient should be instructed to report visual problems or GI disturbances. The general intervention is to monitor the serum cholesterol and triglyceride levels, instruct the patient about foods low in fat and cholesterol, and instruct the patient to follow an exercise program. Gemfibrozil should not be taken with anticoagulants. Do not administer gemfibrozil with HMG-CoA reductase inhibitors.